Good morning, good afternoon, and good evening, everyone. And thank you for joining us from all around the globe today. My name is Julio Sosa. I'm a physician and a health economist, and I work as a global market access and pricing consultant at Alira Health. Today, I have the immense pleasure of welcoming you to the second and final webinar of the Global Payer Forum 2026 series, where patient insights meet better outcomes and sustainable value. The Global Payer Forum is a unique and open access platform organized by Alira Health in collaboration with Universitat Pompeu Fabra, the University College of London Global Business School for Health, and sponsored by Takeda. This is where key stakeholders, from payers and policymakers to clinicians, patient advocates, and industry leaders, can come together to exchange ideas, discuss real-world case studies, and advance on innovative and collaborative strategies to improve patient outcomes. 2 days ago, we explored how patient insights can inform payer decision-making across healthcare systems. But today, we will build on that conversation by looking at how AI-enabled digital tools can improve the way that patient data is collected, analyzed, and put into action to support better outcomes and more cost-effective healthcare decisions. Before we begin, I would like to briefly go over a few housekeeping rules to make sure that everyone has an optimal experience. Please note first that all participants are muted during the webinar. That doesn't mean that you can engage with us. For that, you have the chat function at the right of your panel. We will also have an interactive poll moment throughout the session using Mentimeter, so please keep your phones close to you so you can participate. We will try to address as many as your questions as possible during the interactive roundtable discussion, but if we cannot answer all of them, we will follow up after the webinar. Very importantly, today's session is being recorded, and you will receive a link to the recording via email in the following days. All views expressed during this webinar are those of the individual presenters, and these webinars are for educational purposes only. Content should not be distributed to unauthorized parties. The Global Payer Forum is generally sponsored by Takeda, whose involvement is limited to suggestions on organizational aspects only. Finally, I would like to kindly ask everyone at the end of the webinar to please just take a few seconds of your time to answer a very short survey that will appear on your screen as the session closes. Thank you. With that, I think we can move to the conversation today. Today marks the last of the 2 webinars in this year's series, and we are fortunate to have an outstanding lineup of speakers today. We will begin the session with a keynote presentation from Julián Isla, who will explain and explore with us how AI-powered digital tools can support the generation of meaningful patient data and the conditions for reliability and usability. Following the keynote, we will transition to an interactive roundtable discussion with our distinguished panelists. First, Jørgen Kristensen, who's the retired chairman of the Danish Medicines Council, Professor Greg Hunt, former Australian Minister for the portfolios of healthcare, environment, and industry, and Huguette Diakabana, former co-chair of the WHO Digital Health Technical Advisory Group. Together with Julián, they will explore how AI-powered tools can transform patient-generated data into actionable insights that can support, let's say, more targeted, timely, and consistent healthcare decision-making. As I mentioned before, this roundtable will include interactive polling, so please, we encourage you to participate. So now let's welcome our moderator. The roundtable will be moderated by Dr. Rodolfo Catena. Rodolfo is a lecturer in operations and supply management at the University College of London. He's a specialist in value-based healthcare and leads the value-based healthcare executive education program at UCL Global Business School for Health. He's also a scholar for operations management at the University of Oxford and founded the Discover Health Systems, an academic journal which seeks to improve health outcomes globally and is published by Springer Nature. Welcome, Rodolfo. Thank you for being with us. To kickstart the conversation, and today, since this is a forum at the end, we would like to start by briefly hearing from you. So please take your phones out or have your browser prepared for the interactive poll. We encourage you to participate in this exercise, and all the responses are completely anonymous. The question to kickstart is, where do you see the greatest potential impact of AI-enabled patient data in healthcare decision-making? You may add up to 3 short answers. And I think with that, up to you, Rodolfo. Please guide us.
Thank you, Julio, and welcome to our audience. We have people from all over the world. Welcome to the Global Payer Forum 2026. Let's see a bit of the answers to this question. So where do you see this greatest potential impact of artificial intelligence? So we see rare diseases, and indeed, you know, this is one of the things we are talking about a lot when we talk about artificial intelligence. So the ability also to focus more and analyze data with greater capability to look also at smaller samples. So indeed, I see so many situations in radiology. I mean, we see a lot with the use of artificial intelligence to read scans and be able to support the decision making of radiologists. Streamlining the process, indeed, very much. It can help a lot, artificial intelligence. It can help very much with trying to do different things. I mean, it can help supporting the work of nurses and clinicians with support on how to do things, which can help us identify bottlenecks. And let's maybe look at one of the last comments. So maybe, you know, what we can do, we can look at, I see assisted triage. So very much, this is something that, you know, I can definitely be considered for artificial intelligence, so really supporting the ways that A&D, accidents and emergency wards work, really making sure that, you know, we speed up things. We have, in a lot of countries, at least, a huge problem with waiting time, so something really to consider. All right, thank you. This is very interesting, and to see where you place the greatest impact. I hope, really hope that this provides a useful foundation, and as we move into our panel discussion. I am thrilled, really, to introduce our keynote speaker, Julián Isla. Julián has been a leading voice in the application of artificial intelligence to healthcare delivery and decision making. At Microsoft Spain, he works in the data and artificial intelligence organization, where he leads teams focused on applying artificial intelligence to real-world issues. Healthcare very much part of these problems they work on. He also serves as a patient organization representative on the European Medicines Agency's Committee Foundation for Orphan Medicinal Products, contributing to discussions that include how therapies for rare diseases are evaluated and supported at the EU level. And beyond these corporate and regulatory roles, Julián is the president and founder of Foundation 29, a non-profit using artificial intelligence to accelerate and improve diagnosis and help close the diagnostic gap for patients and families. In his keynote today, Julián will explore how AI-enabled tools can strengthen the collection and interpretation of patient data, and how these insights can support better clinical decisions, payer decisions, and ultimately better outcomes. Of course, the key things we are all here today for patients. Julián, the floor is yours.
Thank you very much, Rodolfo, for the introduction. Thank you for having me here. It's a pleasure to share, you know, my observation regarding AI and how AI can be used into the full cycle of drug development. The reason why an engineer is in healthcare, or my personal situation, is because of my son. This is a picture of my son. I have a son with Dravet syndrome, and this picture was from 17 years ago in an emergency room where we were looking for diagnosis. Probably this picture was instrumental in all the other things I did during the last 16 years, sorry. Next slide, please. I'm a software engineer. I started to work in Microsoft 28 years ago, but after the issue with my son, I changed my career. I focus so much on healthcare that right now I'm in the middle. I'm in the middle of technology and healthcare, and also I have experience founding patient organizations, as Rodolfo already explained. Next slide, please. Just one observation. I'm not a member of the Orphan Drug Committee anymore. I left the committee last month, and I've been there for almost 12 years. I have the opportunity to participate in the evaluation of more than 2,000 applications for orphan drugs, and I have the opportunity also to be involved in, driving these drugs into the market. But from a patient point of view, I have experience as well because I founded the foundation, the Dravet Syndrome Foundation in Spain, and also the European Dravet Federation when my son was diagnosed. Next slide, please. Today in this keynote, we are going to go over from my point of view, two big successes. One, finally, has been my activity with the European Medicine Agency. The other one has been a digital solution that we created for diagnosis. It's very interesting to see how, when we ask people about how AI can be used, people is pointing to rare diseases, people is pointing also to diagnosis. This is the area where we work in Foundation 29. But I also have a big failure, something that I still have to solve, which is the possibility of capturing high quality data from patients. This presentation is going through this journey and also the reflection of how we can use AI. Next slide, please. In terms of success, and I will go very quick on this, I have the opportunity to be involved in products for rare diseases. I have the opportunity to participate in a lot of evaluations, a lot of products at EMA. I guess you have to go to the next slide, sorry. Is slide 6? Yes, that one. For me, this has been a good success. I get experience on drug development, experience on regulatory topics and regulatory science and all the things. Another good success has been the XCPT. The XCPT is a diagnosis support tool that we created using large language model. The big success of the XCPT has been that the tool has been used for more than 1 million of users. Right now, we provide diagnosis to more than 5,000 patients worldwide. It's being used globally, and everybody can use it. And it's being used also in Spanish healthcare services. This has been, honestly, one of the big success. Next slide, please. Something that I still have to try to solve is capturing data from patients. I started this with the Dravet Syndrome Foundation. We created a data platform. We roll out the data platform. We went into qualification from EMA. We get a letter of support from CHMP, but something happened between the patient organizations. Competitions started, and the project was over. And we never able to capture data in the proper way. Right now in Foundation 29, several years after, we are still working on that because this is a big issue. When you are trying to capture data, data means power. Power means reputation, means publications, means money, and competition happen and conflicts. Next slide, please. the situation we have right now is that we are in a good position. We are in the situation where we have more data than ever for our patients, because of the rise of devices, the rise of genome analysis, the rise of telemetry, the rise of digital platform tools. This is a huge opportunity. But the point is that I'm not sure we are capturing this data in the proper way. Next slide, please. When people is talking about AI, and this is a problem we are facing in Microsoft sometimes, the customer is approaching us saying, I want to do a project about AI. And we always say, no, AI is a tool. It's not the answer. It's a tool that you use to solve a problem. And this is a problem that we are seeing right now. AI is so popular that people is focusing just on AI. But the reality is just a tool, and you have to focus on the problem you have to solve. In this case, is capturing patient data. Next slide, please. The hype about AI is creating some mismatch or some misunderstandings. Thinking about it, that AI is just enough to capture data is not. Always is about the process. And the reality is that we are right now still missing this data. And the data is needed for the full cycle of drug development. Next slide, please. Going into the life cycle of drug development, AI can be used for discovering hypotheses. This is a incoming area of activity. You are going to see in the next weeks how, for example, for Microsoft, we are going to launch Microsoft Discovery, which is a agentic tool in order to identify hypotheses and validate the hypothesis. But AI can also be used for clinical trials when you have a good compound and you want to move forward in development, you can use it. And also if the product is successful and you want to go into regulatory approval, you always can use it, and absolutely for market access. Next slide, please. Going to the first one about hypothesis and discovery. Well, it's very simple. In the past, the hypotheses were done by humans. The scientists, the people working on a problem, they create hypotheses and they use experiments using the scientific methodology to solve it. But right now, this is a little bit different. Most of the hypotheses are created by AI, and we are using AI agents or AI models to create hypotheses. It's the first time probably in the history where humans are using, artificial artifacts or tools in order to do this work. Next slide, please. For clinical trials, the problem with clinical trials is, developing a drug is difficult. It's very difficult. You have to be better than nature when you are creating a new product. And selecting patients for the clinical trial and making, the good experiment is difficult. There are a lot of variables, a lot of things that can be grown. And if you use AI, you can, identify the right populations, design the clinical trial in the best way, and also, for example, think about new methodologies to developing clinical trials. For example, using digital twins for control groups. This is something that it was impossible in the past, but right now it's getting more and more popular. And next slide, please. After the clinical trial, you have to go into approval. And approval is also a challenge as well, because at some point you need to transform real-world data into real-world evidence. And it's super tricky because you have to combine clinical information plus information around the patient, which is not clinical and is very difficult to capture. For this particular activity, AI can be used in a way that we are going to discuss today. Next slide, please. And finally, if you have the positive opinion and the product can go to the market, there is the next step for this, which is having a price and having reimbursement. For this, you have to prove value. It's not about efficacy. You have to prove value, and providing value is tricky as well. It's complex. You need to invest time, money, resources in order to get that value. But using AI is opening new ways of capturing that value. Next slide, please. If I have to choose 3 elements of this keynote today, I will choose this one, which is the concept of precision patient data. In the same way that we are doing precision medicine, we are starting to talk about the concept of precision patient data, which is data which is more relevant, is continuous, it's not a picture, it's a movie, it's captured across all the time, is structured using AI, and is managed by citizens in most of the cases. And this is opening new opportunities for all the community working on drug development. For what means for this life cycle? You know, you have new opportunities for regulatory science. You can validate PROs, or you can validate patient experience data in a way that it was not possible before. You can also use the high quality data to collect value and prove that value for payers. And at the end, the product is the vehicle to improve healthcare. You need to provide care as a full concept, and data can be also used to provide better care, you know, not just in terms of drugs, just in terms of healthcare globally. Next slide, please. The other concept I would like you take from this keynote is the concept of AI like a magnifier. The magnifier means that if AI is able to get structured information from unstructured data. And this is very powerful because it's the first time in the history that we have a tool like AI that you can use in order to get more information, magnified information. This is a very powerful concept. This is a slide. I'm in slide 19 right now. The next slide, 20, is about how this amplification applies to patients, right? Because the opportunity that we have right now is that you can capture data using new devices, for example, wearables, devices at home, conversations between patients and healthcare professionals. We are able to use narratives in narrative language to extract structured information. We can move into digital biomarkers. There are huge opportunities on that area. But this is about quantity. The thing is that you can use AI also for quality, because quantity is not important if the data quality is not good. You know, at the end, everybody's looking for quality. And the good thing is that we are able to use AI to improve the quality of the data we are capturing. At the end, the final outcome is to generate more insights that can lead us to value and have conversation with payers and decision makers. Next slide, please. From an industrial point of view, the big change that we are facing right now is the change for paying a product, a medical product. We are seeing how the payers are moving from paying for boxes, paying for units, paying for a particular product, into paying for outcomes. Right now, we're in the middle. We are mainly paying for access, right? But the final goal probably will be that the payer will start to pay for outcomes. And for this particular use, AI can be used in new ways. Next slide, please. This is similar to the previous slide, right? The reality is that if we are using AI, we can capture information that we weren't able to use before. For example, we in the EMA, European Medicine Agency, released a conception paper regarding patient experience data, PED. This is right now in consultation for the public domain, and this document, where I have the opportunity to participate, is drafting the framework to collect experience data. Why we are calling this patient experience data? Because in the past, I guess everybody in the call is familiar with PREMs, PROMs, patient-reported outcomes, patient-reported experience. It was confusing. It was very difficult to know where is the border. Right now, we are trying to, use both terms and use just one, which is PED, patient experience data, because the main concept is everything around the patient is an experience. And using new methodologies, you can capture this experience. Next slide, please. Something that you have to consider, because this is probably one of the biggest issues we have in Europe, is that right now developing this type of technology from a regulatory point of view is complex. Right now we are in a difficult situation. For product developers, I mean SMEs, startups working on these digital solutions, they have to deal with GDPR regarding data privacy. They have to deal with the AI Act, regulating AI tools. And also on top of this, they have to deal with MDR, the medical device regulation, which is regulating the marketing of new medical products. The issue we are facing right now is there are clear overlappings between the three different regulations. But the good news is the European Commission is very sensible about this situation. And we really hope that in the next digital omnibus that the European Commission is going to release in the next weeks, they will eliminate the overlapping between the regulations, and the citizens and the companies and the industry will have a better understanding of what the specific milestones they have to achieve to be fully compliant. This is the final slide. Next slide, please. Yeah, that one is the final slide for the different stakeholders on this call. For payers, the payers probably they're moving right now into collecting value or asking for value, not collecting, asking for value. Probably they will start to think about patient-reported outcomes or patient experience data for each submission in order to get that value. And we can use AI to transform real-world data into real-world evidence and be able to achieve this requirement. The other role are the healthcare provider, the healthcare systems. The problem we are facing with this, the system that we have, is that they are not focused on capturing data. They are focused on medical procedures in most of the cases. And this is an issue because everybody, I guess, is familiar with the problem of capturing data. So probably the call for them will be to start to think about creating processes, creating services, creating institutions focused on data, because probably this will be the basement, the grounds where the future solutions will be built. For drug developers, for the industry, not just drug developer, also medical devices developers, the main takeaway from them maybe is that it's going to be very important in the future to design or co-design technology and products with patients and optimize those products for value and creating the value for these products. Because if not, it's going to be difficult to prove that the value is there if you don't consider the design from the beginning. For policymakers, I guess in a global point of view, the policymakers, they have to facilitate. I mean, everybody, sometimes the people is perceiving regulation like a barrier, but from a regulatory point of view, the regulators prefer that the role they do is perceived like supportive rather than reactive. And this change from being reactive to be proactive probably is the main call for regulatory bodies. Next slide, please. That's the final sentence for the presentation. I don't think AI will be able to solve healthcare, but I guess the data from patients will do. Thank you so much.
Thank you very much, Julián. Virtual applause for you. So we have, as you said, 4 stakeholders, 4 asks, and no excuses. Very comprehensive keynote. You helped us reflect on opportunities and challenges of using artificial intelligence to boost patient insight into healthcare decisions. We will now move into the interactive roundtable discussion, where we will explore these themes further from different perspectives. All right, very good. So that's exciting, very exciting to have all our panelists together. Before we go into the debate, I'd like to briefly introduce our panelists. And before I do that, I explain you a bit more about the themes of our panel. So we will talk first of use of artificial intelligence and patient data. And second, we will talk about operational and governance mechanisms for artificial intelligence implementation. So we go from the first themes, which is really focusing on talking a bit more about artificial intelligence and patients, to really looking at how we do it, so operations and governance. So for each theme, I might direct the opening reflection to one panelist and then invite others to respond. We will also incorporate audience input through live polling and questions throughout the session. All right, very good. So let's go back and let's start with talking a bit more about our panelists. We will begin asking them one question each to ground our discussion in their respective experience. So we will start with Greg Hunt, Professor Greg Hunt. Good evening. Greg is in Australia, so it's an incredible pleasure to have him with us tonight for him. He brings almost 2 decades of experience in Australian Federal Parliament, including cabinet roles as Minister for Environment and Minister for Industry, Innovation and Science, giving him a rare end-to perspective on how policy, innovation and system sustainability come together in practice. Thank you for being with us today as a former decision maker at the highest level. And my first question for you is, what do you think are the biggest opportunities for artificial intelligence integration in healthcare decision-making? Over to you, Greg.
Well, thank you very much, Rodolfo, and hello to everyone who's joining us today, wherever you may be in whatever time zone you're in. For me, I think there are probably 3 primary opportunities. The first is the back office. And that may not sound exotic or exciting, but it's about streamlining, making healthcare delivery more efficient. What does that mean in practice? That means something as simple as patients doing their bookings and being able to speak to an AI sort of avatar or worker at 2 a.m. or 3 a.m. to make their booking, to be suddenly get their endoscopy done, and to be able to then link that to the rostering. And that means that if a nurse has a crisis with a family member at 4 a.m., the AI system can ensure that the list goes ahead by finding other workers to replace against known possibilities in rapid time. And then the third is claims. You know, these are all the back office things where you can streamline the process for payers and providers to go through, whether it's government or private claims, in a way which reduces inaccuracy, reduces rejection, increases the efficiency of the process. The second big area, assisted diagnosis. That's the clinical side. It's not going to replace the doctor or the clinician at this stage, but in areas such as radiology, skin cancer, genomics, carrier screening in particular, it can allow for earlier diagnosis, earlier signs, and progressively more accurate as the models develop. And then the third area that I think is really important is patient interface. So the capacity for the patient to engage with the avatar of Dr. Julián or Dr. Rodolfo, if it's the middle of the night, if it's somebody facing a mental health crisis, to get an urgent triage and therefore to be referred, if necessary, to a critical assessment team. These are real benefits that are occurring now, but will evolve rapidly over the coming 2, 3, 5 years with the evolution of the AI models. And all of them are benefits to patients and benefits to payers, because there are reduced numbers of catastrophic outcomes and increased occasions of preventive or early intervention as a result of the diagnostic capability.
And we can see again, thank you, Greg, for this clear answer, what came up in our interactive discussion with the audience, these triages, this use of artificial intelligence for triage. We have a second tremendous speaker for our panel today, Jørgen Kristensen, representing payers as former Chief Medical Officer at Aarhus University Hospital, and please forgive me if I am butchering a bit the Danish accent, and the Regional Health Director. Jørgen has been chairman of the 2 consecutive Danish National HTA organization for hospitals, drugs for the last 12 years. The last 8 years chairing the Danish Medicines Council. By profession, Jørgen worked as a clinical hematologist, but also had leadership roles in the evolution and implementation of digital solutions and clinical datasets in regional and national data warehouses and the analysis of very large datasets. Welcome, Jørgen. Please share with the audience, what do you think payers are most interested to hear when it comes to incorporating artificial intelligence, AI, to their decision-making processes?
Thank you, Rodolfo. Thanks for the opportunity to be here, and it's really exciting. So first, I think as buyers, we look into a healthcare system where new treatments arrive fast. They arrive with perhaps less evidence of value to patients, and the costs are still relatively high. And this comes to a healthcare system that in most places are kind of short of money, and in some places short of staff. So this puts pressure on healthcare systems. So what we as payers in healthcare systems want is actually new ways to prioritize fast and evidence-based on more detailed data sets, especially regarding value for patients. And we need evidence generated that can be acted upon, as already mentioned by Julián. So we are looking into a future where we definitely need AI to help in creating this process. And this is only in the beginning of a new treatment. I think we need to follow up on treatment. We need to learn from all treatments we put into place, so we become wiser as clinicians. And we also needed to make new outcome-based reimbursements agreements with companies, because some new drugs cannot be paid in full, but can be paid after efficiency. And all of this needs basically to focus on patients and patients' data. So the future needs to become more patient-centric, and it needs to become still trusted on both sides. So we need, as already mentioned, to improve the use of patient voices, as Julián beautifully mentioned. Quality of life data is relatively scarce, and they should be abundant. And we still need to demand that the new data sets and the new evidence is independent, scientific, and trustworthy. But I think AI could definitely help.
And thank you very much also to Jørgen, and very much the role of artificial intelligence in managing the data that at the moment is scarce, as Jørgen was saying, about outcomes and quality of life, that hopefully we will be able to expand a bit more in the future. Our final panelist, it is another fantastic panelist, Huguette Diakabana. She is a global health thought leader. She is a practitioner for digital transformation and for responsible artificial intelligence. She has spearheaded innovative programs in over 40 countries. She focuses on bridging the gap between people and quality in healthcare. She is formerly the co-chair of the World Health Organization Digital Health Technical Advisory Group. She now collaborates with governments to scale artificial intelligence solutions, serves as a senior fellow at the Aspen Institute, and is a lecturer at the Harvard Medical School. Additionally, she mentors emerging leaders in the African diaspora, fostering the next generation of health and technology innovators. Thank you, Huguette, for being here with us to start us off. What are the main contextual challenges that we need to take into account when debating this topic with emerging economies?
Thank you, Rodolfo. It's good to be here, to be back. This is my second time doing this. And hello, everybody, from wherever you're logging in from. Thank you for being here as well. There's a long list that I prioritized a few. And one of the key issue is in emerging economies, we have such a diversity of context. So we could have in one city where you have everything you need to deploy very advanced technologies, and then just a few kilometers or miles away, you are unable to do the same. And most of the time, these facilities are being managed by the same government, so they have to account for that wide variety. So that remains a big challenge, the diversity in infrastructure. It has improved tremendously, and it is continuing to improve. And I have to say, I'm glad that we're not allowing, the emerging economies aren't allowing these infrastructure challenges to stop us from already adopting advanced technologies that we can implement. And we're seeing, I'll speak a bit about later on what we're seeing, and the improvements and the value of this. And so that's really a key thing for anyone wanting to work in emerging economies, just the diversity and planning and accounting for that. We're also still dealing with the digital literacy at the moment, especially AI, and much of what was in place for digital health remains to be for the experts. So even minimally trained health workers are unable to interact with some of the solutions we have. So training is still something that we have to plan for, no matter whether we're a payer or provider or an investor or a funder, recognizing that as new technologies become available, as new capabilities become available, deploying them would not be as quick as we think, because investing in the foundational pieces is still very critical. And also, depending on the culture, we're talking about patient feedback and the importance of the voices. So as much as I've seen an improvement in collecting data, the qualities, as we've heard from other speakers, is still to be debated. But we're good at collecting data, and patients are becoming more and more comfortable in providing symptoms, for example, so that their care can be provided effectively. However, care providers, especially doctors, are in many cultures are still viewed as people of authority. And so getting patients to provide feedback, especially when it's not positive, is still a challenge. So Julián talked about some of the work he's doing with supporting patient groups, and I think that is very critical, because even when tools are provided, patients are very, they're not always ready, or sometimes there's a bit of fear in providing information if they feel it is not going to reflect positively on the care providers. So those are some of the things I wanted to prioritize when it comes to some of the challenges that we are to expect when deploying AI in emerging economies. Thank you.
Thank you very much, Huguette. And indeed, there is this cultural aspect that it is essential to consider when we talk about patient outcomes data and artificial intelligence. All right, so we completed the first part of our discussion. Now I would like to invite you all to join the debate. Okay, so we would like to start the debate with a question for the audience. So the question that we would like to ask is the following. To what extent do you believe artificial intelligence currently strengthens patient participation in a healthcare decision-making in your country? So let's see a bit if you agree or disagree with this statement. All right, so the scale goes from 1 to 5. So if you say 5, 5 means that you strongly agree. So there is a significant impact of artificial intelligence in enhancing patient participation. If you say 1, actually you say not at all. So artificial intelligence is not really helping patients to participate at all. So I see that we have already 44 people that have responded, and the value at the moment is around 2.3. So 2.3 is really just, you know, we are at the beginning. We are just starting to see artificial intelligence supporting this more importance, this more role of patient voice. All right, so this really is inspiring me a question for Julián and Huguette. So I would like to ask you a question about the value of artificial intelligence. So maybe we start with Julián and then we go to Huguette. So I just would like to ask you a bit more from your experience about where the value of artificial intelligence is clear, and it is really strengthening the patient participation in healthcare decision-making, is helping the delivery of care, or maybe where the value of artificial intelligence is still unclear. So it's not really very clear what is its impact. It's more hypothetical, it's more of a hope. So maybe let's start with you, Julián.
Well, as we can see in the results of the survey, the people is skeptical about the use of AI for this, because I guess it's the topic I presented on my presentation. It's a tool. You have to use AI for something, you know. And I will give you an example. You know, when I joined the Orphan Drug Committee at EMA, the first day I meet, I was involved in a discussion for a product for Dravet syndrome, the condition of my son. And the committee asked to me a very specific question, which is how many people in Europe is taking this particular drug? And I didn't have any data. So I was not able to influence the decision making of the committee with data. So I guess we have to, you know, move a little bit away of the discussion about AI, because the key message to patients, patient organizations, and the different stakeholders is data. You need the data, not AI. You mean, if AI is used to get data, fine. If AI is used just because of the sake of using AI, I don't see the point for that.
And I think this is part of that cultural change. So really starting to understand the real role of artificial intelligence as a tool rather than the endpoint itself. What's your take on this, Huguette?
Yeah, just one small observation as well. Yeah. People right now is thinking about AI, thinking about large language models, because large language models is the first, instrument that people touch using AI. But AI is much more than large language models. It's about, a lot of tools that we can use, usually in machine learning to get insights. But all these tools, the common pattern they have is they need high quality data, all of them. So I guess this message, especially for patient organizations, is very important, because I struggled in the past to explain the importance of data. And right now, this is much more critical than ever. And as you say, Rodolfo, the people need some kind of cultural mind change in order to focus on data capturing.
Definitely. And I totally see also what you say about the focus currently on a specific part of artificial intelligence, generative artificial intelligence, while it is indeed much more. Huguette, what's your take?
Yes, I definitely agree. I'll start with the challenge. So one of the questions that we're posing, we're currently working in one country specifically, but it's an effort that's Africa-wide, so Sub-Saharan Africa. It's in being able to use the capabilities that we currently have with AI, a very simplified version, to allow us to get a sense of what we actually know about a health system, meaning all the data we've been collecting with digital health programs over the past 10, 15 years in some countries, what has it told us exactly about our health systems? Because we're trying to, as Julián says, right, it is a tool, and we're trying to use it to solve problems that we may not necessarily understand. When it's a one-on-one care provision, it's, of course, we're best positioned to understand what's going on, because we're analyzing very specific symptoms or samples. But when it comes to population health, which is also a big contributor to the individual health, is that there isn't clarity in how we're doing and whether or not the inclusion of technologies has really helped us improve our overall health. We see that NCDs, the rate of NCDs are increasing, and diseases are appearing in places where they didn't exist before. So what can we learn about our systems, and why are we going down these paths where the burden seems to increase, even though access to health is in a lot of places improving? So that's one of the challenges that we're trying to ask. How can AI help us understand what we have, so that we can ask better questions and leverage existing solutions and existing data to be able to answer them and plan differently? Where we are seeing progress, I would have to admit, a few areas like triage, where and that's where patients have some level, not perfect, but some level of control, because in some places where patients will have devices, and it's often the middle class and up, they're able to communicate their symptoms directly, sometimes from the comfort of their homes. In some places, they're able to make their own appointments. I had an experience recently where I live, where in the middle of the night, I decided to do a self-test, and I thought I saw something, and it was quite scary. And right then and there, I made an appointment through an application. By 8 a.m., I was at my doctor's office. By 10, I'd gone through all the screenings I possibly could. And by lunchtime, I knew nothing was wrong. And so when I'm asked, what can AI allow us to do, is we know what is possible when we have the tools that are used in the right ways. And so how can we think about what questions we need to ask in order to make some version of what I experienced possible for people in different contexts? I'll stop here for now and allow others to contribute.
That's, you introduce very important topics, and, you say, the importance of equity, I mean, it's clear for everyone, but you also say, we have some value, and, we need to look at it also at the population health level. So AI is going to have as a tool an impact on the value for our population. So maybe I can ask Greg, so thinking about these measurement, these tracking of the values that AI is going to give us. So which metrics do you really think we should track to prove these gains from artificial intelligence?
Firstly, utilization. And what does that actually mean? So I'll give you an example from my country, Australia. General practitioners, so GPs, are using AI as a script service in patient meetings. Now, you might say, well, that's just administrative. But the outcome is that GPs and patients are both saying there is better engagement, because the general practitioner is no longer just a note taker. They, as a number of GPs have said to me, different versions of, I get to be a doctor again. And patients have said, my GP is much more engaged. So what level of uptake is there in the community is the first of the metrics. And Heidi Health, for example, in Australia, which is probably the leading service here, that's being used itself by about a third of GPs. GP scripting services in Australia by about half of GPs. We should be pushing to try to get that to the ordinary standard procedure. The second thing is in terms of accuracy, and at the moment we're looking at deviations from the norm, where we're using a benchmark of sort of lived experience and clinical experience in radiology and pathology. In some cases more accurate, in some not, and it's the ones that are not which are evolving very quickly through the models that Julián and others are developing. But the accuracy is the second metric. And then the third metric, I think, is improvement in patient outcomes. So, for example, the ability to diagnose patients at risk of carrier screening, or taking forward an inheritable genetic condition such as spinal muscular atrophy or cystic fibrosis. So those three things of uptake, of accuracy, and improvement, all of which are measurable, and they are indications of the exponential curve which AI is traveling. In a way, we are still only at the inflection point. We haven't climbed up that curve, and by 2030, all of those three metrics will be significantly higher.
And this is what you say, is inflection point is very important. So, it is, as we saw from your discussion, another element of incredible relevance is the tracking of the gains of artificial intelligence. So this tool, how it is changing, as you said yourself, Greg, patient outcomes. So I guess that, we have, as Julián was saying, we have tools that, can have an impact, can help us out. Then, Huguette was mentioning about, it is important to look at the population health level. And, as you are saying, we can start to track these population impact and also on healthcare workers. So this really is making me ask the question to Jørgen, so to look a bit at the perspective of the payer. So, we are in a situation where a lot of times we pay for a product, we pay for medicines, and, Julián in his presentation himself, he was saying, maybe we will start to pay for outcomes. So do you think that AI will push payers to think more about it, maybe to shift from a perspective of paying for a product to a perspective where they are paying for outcomes? So they're paying maybe for the medicine, the medical device, and in addition to that, maybe that artificial intelligence that will help increase the impact of this medicine.
First, I think I already mentioned that healthcare systems in many places are under increased pressure to perform, and that drives a higher degree of prioritization. So I think as a healthcare payer, I would really like AI to supply better evidence, especially around patient value, to do the prioritization process rapidly. So if anybody can bring patient-centric data set as a basis for AI evidence that can be trusted, then we would be happy to use it. And that's basically for the secondary use. And I'm a clinician as well. And I've tried to implement AI in the clinical setting, in the emergency room, and it's really useful. We're following the trend of taking patients out of bed, reducing length of stay from like 6 days to 3.4 days. And then they are outpatients, and now we're trying to remove outpatients and make them become home patients using new digital communication and AI. And every time we try to do it, we need to talk to clinicians and patients about this can't be trusted. You're safe in this system. And quite often they ask, on which ground did you actually decide that I could go home or not? What was the central data set? At least clinicians are really interested in some kind of explanation, not just a black box.
All right, excellent. So thank you, Jørgen. And we see here that indeed, we have products, we have medicine, we have medical devices, and there is this question how we can really increase their impact. And artificial intelligence is definitely something that could be considered. All right, so I think that Jørgen's answer also allows us to move to the next session of this panel. So we are going to talk in this theme about operational and governance mechanisms. So maybe we can start with asking the audience a second question. What is the biggest challenge to integrating artificial intelligence into payer financing, procurement, and reimbursement decisions? You can select up to 2 different answers. And it is a bit small, the font there, but one answer is high implementation and infrastructure costs, limited access to high quality or interoperable data. Then there is the third one, which is lack of internal capabilities to evaluate and apply artificial intelligence insights. 4, governance or regulatory constraints. And 5, unclear return on investment for funding or procurement decisions. So we see at the moment, I give you a few more seconds to answer, but it seems that one seems to be winning. It seems to have a bit of an advantage. It is the third one. So lack of internal capabilities to evaluate and apply artificial intelligence insights. Very, very interesting. And also I can see the other 2 are governance. So we have a lack of governance or regulatory constraints. And the third one in this list is unclear return on investment for funding or procurement decisions. What do you think, Greg, of these results? Do you agree with them? So as you can see, the dominating one is lack of internal capabilities to evaluate and apply artificial intelligence insights.
So I think that there are 2 main challenges which are limiting the uptake. You have to think of it from a patient perspective and then from a system user perspective. From the patient perspective, to take Jørgen's point, the word trust, they have to get over the 2 items of consent and anonymity. They have to believe that their data is being protected and that it's being protected in a way that their personal sort of health concerns, whether it's sexual health, mental health, whether it is something relating to a genetic condition, that's absolutely secure. We had this issue in Australia with the creation of a national health record. We moved from opt-out or opt-in to opt-out. We went from 10% to 90%. There was a lot of concern, but trust is built, and even more people. We've now got to 25 out of 27 million people that have adopted it. The same thing has to happen, that trust reinforced by consent and anonymity. Then on the system user side, probably the biggest thing is almost inertia, that a lot of the CEOs I speak to are just overwhelmed. It's not that they don't necessarily trust the system, they just don't know how to do it. And so, a great example is where the US intelligence agencies got consent to use a DNA company's DNA material to solve violent crime. They sought patients who were willing to contribute their DNA profiles on an anonymous basis. They got a 66% uptake, which was an incredible surprise, but the agencies and the firm were willing to do it. They solved the Golden State Killer, and that reinforced the value of it, and more people signed up. And that case study showed two systems, corporate owner and a public user cooperating to break the inertia, and that in turn built private donor trust in the system. So that's, I think, a good example of how it can be done.
Yeah, we can see it also from the audience. Governance is indeed one of the things that highlight. I think that maybe I will call back Julio and the Alira Health team. I would be interested in this moment to hear if there is any questions from the audience to a specific panelist, or in general, any questions they would like to ask.
Thank you, Rodolfo. And this is a great timing for this, because we have received a lot of questions on one key topic, which is data sharing. I don't think I can mention the names, so thank you. You know who submitted these questions. But in general, I would summarize it as many people have highlighted that for AI to reach the highest potential in decision-making in healthcare, it needs quality data that is interconnected. How do we incentivize the sharing of that data from the different stakeholders' perspective?
All right, thank you, Julio. I don't know, maybe anyone would like to answer this question? Jørgen, Julián, what do you think about it? Or Jørgen, over to you.
Thank you for the question. I think the sharing of data calls for basically trust and some kind of incentive for the user, and that could be the greater good, that incentive, like catching a killer. But I think the trust is basically what we search for, and in high trust countries and healthcare systems, patients share their data, almost all of them. Even if there's an opt-out option, they do not use it. But that calls for high trust, and that means, as a buyer, I'm here as a buyer, but I'm also a physician, and I think we could have much more data if the patient and the clinician could work on patient-reported outcomes in the clinical setting, a way of communicating, and we could standardize those as well. And then we can use that huge amount of data from the daily life in hospitals for secondary use. So that's an incentive as well.
The use of patient-reported outcomes as well as a way to improve patient health together with trust. Julián, I saw that you wanted to say something as well.
Yeah, I agree with Jørgen that, you know, everything is about incentives, you know. And the problem is, if you don't have the incentives aligned with the outcome, you have an issue. And right here, the problem I see is, from a patient point of view, you don't have the right incentives to share your data. Because, for example, if you share the data for non-profit because you want to donate the data, in the same way that we are donating blood or organs, this is full regulated. For example, in Spain, when I'm blood donor, when after donation, 1 week after, the donation center is sending to me a letter with the results of the analysis, saying thank you, and saying your blood has been used in 8 people. And you feel good, you know, you have some incentive to do again. But we don't have a good model to donate data for the benefit of others. I mean, you don't know what's going on with data, you don't know what the hospital is doing with the data. There is no return for this, you know, for non-profit. But and this is guessing, right? I don't know if this is going to happen, but probably we are going to see new economical models where companies will offer value to the patients for the data, economical value. You know, this is happening right now in the US. In the US, there are companies approaching rare diseases patient organizations saying, okay, I will take care of your data. I will build the database for you, the registry, everything. I will use the data with the industry, and I will share the revenue with you. This is a strong incentive, you know, because most of the patient organizations, they are struggling with finance and you know, incomes. So probably in the next years, we are going to see new business models where the data is being used like an economical asset. The data is going to be tokenized. There are new models where the patients will find not just you know, financial return, but just also value return. Everything is going to be around this concept. But right now, we are not in a good situation with that. We don't have the good framework in order to provide value and incentives for patients sharing data.
And this is very much a question we should ask ourselves for the future. And, you know, maybe that allows us to go to the third and final interactive question, which is also about the future. Where should healthcare systems focus next to advance artificial intelligence-driven integration of patient insights? Okay, so you can see here different answers. One is strengthening real-world evidence to inform reimbursement and coverage decisions. Supporting value-based procurement and contracting models is the second answer. The third one is improving healthcare delivery efficiency. The fourth one is enhancing transparency and trust in AI-supported decisions. And I think, you know, we talked already about trust as well. And the last one, building internal payer capabilities and evaluation frameworks. So we see that, you know, there are more and more people answering. So we have 53 responses, and the graph is being updated. So where should we really focus on to advance this artificial intelligence integration of patient insights? So the fourth one that is mentioned is enhancing transparency and trust in AI-supported decisions. So it really seems what you were talking about, Jørgen, isn't it? So we have a confirmation also from our audience and in general from, of course, the people, our payers as well. So let's see the second one, improving healthcare delivery efficiency. So I guess this is also related to what you were saying, Jørgen, when you were talking, you know, we want to collect outcomes, but, you know, there needs to be a return. And this is something Julián was saying as well for the patient. Maybe the return is also a return in terms of health. You know, if there is a problem, we know it and we act before of course, it becomes too big. All right, very good. So I think that this allows us for one final question that I really would like to ask Greg. This is about policy. And I would like really to ask you, Greg, about what policy changes are needed for effective artificial intelligence implementation.
Sure. So I think the first and most important is to allow the transition from it being considered as software to being evidence-based therapeutic or diagnostic treatment. So we pay for pathology services to analyze blood. We pay for radiology services to conduct a CT or an MRI or an X-ray examination. Where there is enhanced diagnostic capability, I think that the HTA policy has to evolve to allow for additional reimbursement for significant value add, because otherwise that will delay, if it's not put in place, the uptake of improved systems and improved outcomes, and therefore reduced overall health costs. So by supporting the improvements, we can actually reduce the overall burden on the system. It's generally not done around the world, but I think that's the next evolution of quantifying the benefit of what you would call assisted and improved diagnostic tools because of AI, and therefore rewarding them, and therefore getting earlier diagnosis, better and more accurate treatment, and therefore better patient outcomes and lower system costs.
Thank you to Greg, to our panel. And as we conclude, I would like to ask each of you for one brief final key takeaway. I would like to ask you very, very short, what is one concrete step that stakeholders should take today to ensure that AI-enabled patient insights translate into real improvements in healthcare decision-making? And so maybe we can start with Huguette. So what is your takeaway from today?
Thank you so much, Rodolfo. One of the things I wanted to note is that I've learned in my time in working with patients or even care providers that there is no trust built without understanding. So investing some time, so Julián's work is why I'm a big fan of it. Investing some time in ensuring that patients understand exactly the transparency aspect that Jørgen also brought up is very critical. I wanted to share one example where a very confused group of researchers from a high-income country contacted me. They went to a very low resource setting and wanted to work with cancer patients, and the patients refused to provide the data they needed, that these researchers needed to support them. And they couldn't understand how could people refuse to share what we need in order for us to save their lives. And I went there just in a day, sat on the floor, exchanged with them, and went and explained sort of piece by piece what the work would entail. And even though the research wasn't necessarily tied to access to treatment for these patients, once they understood what these researchers were doing, they were more than happy to help them. And that's one example. I have many others that I can share. So investing in ensuring that patients understand exactly what we're talking about, what we're trying to do with their data, how it's going to be used, to me is a very worthwhile investment. Thank you.
Patients need to understand how to use data. Julián, over to you. What is your key takeaway from today?
Well, I would say AI is just a tool, but it's going to be repetitive. So the comments from Huguette, you know, I mean, the issue is that we are living in high-income countries, right? Our healthcare system has issues. It's okay, but I have the opportunity to work in a project on Mauritania in Africa, and the problem they are facing is they don't have doctors. I mean, when the people is leaving the medical school, they are going to other countries, and they don't have doctors at all. So AI can be a good opportunity to not improve, but provide healthcare to countries with no resources right now. And also for high-income countries, this is going to be an opportunity to extend clinical trials, for example, for those countries, and be able to collect evidence from a broader population. So I can see like big opportunities for humanity as a whole, you know.
Thank you, Julián. So expanding access, if you can summarize it in 2 words.
Yeah.
Jørgen, over to you. Your key takeaway.
Yeah, thank you. I think we should keep still trust in focus, but also incentive, as mentioned. One of the key things is patients are actually interested in patients like me. So that could be an incentive to give access to that. Second, I think as a community, we need to establish perhaps an AI-based system on patient outcomes, patient-reported outcomes, and create a world where we can learn from every treatment we give. Because basically, we have lots of data. We still need standardization, and we need some from patients. But we got loads of data that we're not using. So just using the data we have, and that means we should try AI out on existing data while we are improving access to better data, just to learn how to use the tool, as Julián mentioned. So let's get working.
And this circles well with what Julián was talking in his presentation about the need for better data. Greg, your final takeaway from today.
I think we can create the hospitals of the future. Now, what does this mean? This is revolutionizing the hospital, moving from the classic four walls institution to overnight, day, recovery, or sometimes called low acuity, a hospital in remote communities, whether it's in developing countries, such as Julián has been talking about, or indigenous communities, such as in Australia, and then hospital in the home. And what does that mean? We've got 3 new tools that come together. One, the remote devices, whether it's the Apple Watch or the continuous glucose monitor or other forms of diagnostic monitors. 2, telehealth. And 3, the AI capacity to in real time detect the risk of a fall, somebody who's having a medical event, somebody who's at risk of having a medical event. And all of those allow us to actually democratize access to people who are in remote settings or not in the hospital itself, to reduce the cost per episode of treatment. And that means reducing waiting lists and increasing throughput and treating more people. So that hospital of the future is good for payers, good for providers, and above all else, good for patients. And it is, to take Julián's idea, powered in part by the tool of AI. It's not the goal. AI is not the goal. It becomes an enabler of a transformation in the delivery of healthcare with real-world patient impacts.
If I can summarize this, hospital of the future. And this can be an opportunity for a developed nation and developing countries as well. So really going from a situation where we are improving step by step to a situation that puts us into a new game where we can have an opportunity for a bigger improvement, more drastic improvements. And that's great. With that, I would like to close this panel by thanking our distinguished speakers for sharing their knowledge and insights today. Thank you all, and back to you, Julio.
Thank you, Rodolfo. Thank you, Julián, and all the panelists for the food for thought that you gave us today. Over the course of the Global Payer Forum 2026 series, we have explored how patient insights and AI innovation can help healthcare systems make better decisions and deliver better outcomes for patients. We hope that these discussions have provided new perspectives and practical insights that can help you move toward more sustainable and patient-centered healthcare systems. Now, to close the 3rd edition of the Global Payer Forum, I would like to take a moment to thank everyone involved in making this possible. First, I would like to please invite Karen Likonski, Head of Global Public Policy at Takeda, for a closing remark. Karen, the floor is yours.
Thank you, Julio, and to everyone else online. It's truly been a privilege for Takeda to partner once again with Alira Health and our academic collaborators, UPF, and the UCL Global Business School for Health on this year's Global Peer Forum. Together, we've created a meaningful space to examine how patient insights are evolving, how technology is transforming what's possible, and how this shift can strengthen the decisions we make across the healthcare systems worldwide. Over the course of this edition and Tuesday's webinar, we've seen just how critical patient-derived insights have become. We've explored the frameworks that help capture them, the moments across the care pathway where they bring real value, and the alignment needed amongst clinicians, policymakers, HTA bodies, and payers to ensure that these insights translate into consistent, meaningful decisions. We've also seen how AI and digital tools can operationalize patient voices, making them more precise, more usable, more impactful in informing assessment, reimbursement, and care delivery conversations. What's probably stood out the most is a shared commitment across all stakeholders, payers, providers, patient representatives, policymakers, and academics, everyone coming together to build systems that are not only more patient-centered, but also more sustainable. The ideas and energy brought forward today show that collaboration remains our strongest catalyst for progress. On behalf of Takeda, I want to extend our sincerest gratitude to all speakers, partners, and organizers for the expertise and insights that you've contributed, and also to our global audience for your engagement throughout this discussion. Each of you are playing an essential role in driving the ongoing transformation of healthcare. I really do believe that we are at a pivot point for truly transformational change. As we conclude this year's Global Peer Forum, I hope you leave inspired by the momentum we've built together and are encouraged by the practical ways we can continue shaping healthcare systems that deliver better outcomes and long-term value for patients. Thank you again for joining us, and we look forward to continuing this important dialogue with you. Back over to you, Julio.
We cannot hear you, Julio.
Thank you. Thank you, Rodolfo, and thank you, Karen. I would like to invite now Ahmed Bashara, Executive Vice President at Alira Health, to make the final closing remarks.
Thanks, Julio. First of all, I would like to give my huge thanks to all our expert speakers who have really enriched us with their valuable insights, experiences, and I heard a lot of also visionary ideas, case studies, examples from your everyday work, and also practical recommendations. Definitely will be in touch. I would like to thank again our academic partner, Natalia and Jorge from UPF, Rodolfo from UCL, who have really played an instrumental role, and they went really behind and beyond in shaping the program in true partnership. We look really forward for long-term partnership together.